I am so sorry. Can you hear me? Thank you for
Welcome to the Voice of South Pacific, a Pacific Islanders broadcast from Seattle, Washington. Today is November 14 of 2023. Welcome everybody. This is a special program conducted by Seattle King County Public Health, and we have a great topic today. But before that we continue on with our topic of discussion, it's talking about like the health insurance, and Brenda Collect will conducted that, and also we will talk about the COVID vaccine. But culturally, we always start everything with the word of prayer, and so I would like to invite Pastor Aseli. He is our pastor on this program, to please lead us with a word of prayer before we continue on. Thank you, Pastor Aseli.
Let's pray. Heavenly Father, thank you for this time together of sharing information, Lord, for our community. We're grateful for the opportunity. We're asking you, Lord, for your blessings just to get a hold of what we need to get a hold of today and share with our family, share with our people, oh God, what is needed to be known in this very hour. Thank you for the opportunity, and thank you for the platform that we all can come together, unite for this reason of informing our community. Lord, let it be your special grace upon us as we share with one another. In Jesus' name, amen.
Thank you, Pastor Aseli, for leading us, with a word of prayer to bless our program as we continue on. We'd like to welcome our special guest today. Thank you, Kate Cole from the Seattle King County Public Health, for always arranging, our topic of discussion as we come together with the Pacific Islanders leaders. And also we have Brenda Collect. She will be the one that will talk about the health insurance open enrollment. And also we have Deborah Belina will talk about the COVID vaccine. So thank you so much, for joining with us today. And I think before we continue on, is Brenda in? Or we will start with Brenda Collect. Hi, Kate.
Brenda is on.
okay. Now I'm not mute, right?
Yes, I would like to introduce you. That's one of the a representative from the Seattle.
Thank you, Sylvia. Yahweh, and that's greeting and Marshallese. I'm Brenda Kalik from the Marshall Island, and I do work with public health as a navigator, and I'm so happy to be here today.
So much, Brenda. And I wanted to say hello. We have two others, from the Pacific Islanders Health Board. Before we continue on, would you like to introduce yourself too?
Yes, thank you, Auntie Sylvia, for having us on.
Yes.
Aliroy, hello everyone. My name is Diela Uegi. I'm the manager at the Pacific Islander Health Board, and I'm also the Palawan Healthcare Navigator.
Oh, welcome, Palau. How to say hello in Palau?
Ali.
Ali. Oh, that's so simple and easy. Yeah, did you hear that, Kate? Ali. ALII.
Ali.
Say hello. And could you introduce your co-host, from the representing the PI Health Board?
Hi, I'm Viola King. I'm the Samoan Health Navigator at Pacific Islander Health Washington, and I'm also the Civic Engagement Coordinator as well. Thank you for having me, Auntie.
Thank you so much for joining us. So we're going to start, Pastor Sally. We're going to continue with the first topic, health insurance open enrollment. Pastor Aseli, would you like to lead the question before we continue on? Because I would like to give the opportunity for each person to participate. Pastor Aseli, are you still inside? Do you see Pastor Aseli? Yeah, Pastor Aseli, if you
Yeah.
can unmute yourself and yeah.
My question is, what is the health insurance open enrollment?
Thank you.
Can you hear me?
Oh, and you're muted, Brenda. There we go.
Yes, thank you. So yes, I heard you. And open enrollment, it starts from November to January 15, and to have coverage for next year, which is going to be 2024. To have coverage on January 1st of next year, you have to submit your application. You enroll from November 1st to December 15, and then you will have coverage start January. If you enroll after December 15, which is 16, to January 15, then your coverage will start on February. The enrollment is for what we call qualified health plan, which you pay for your premium, and you purchase that, and it's you might qualify for tax credit or cascade saving, depending on your income, your household, and your tax status. Yeah, and the federal, the tax credit comes from the government, federal government, but the cascade program is from the Washington state.
Thank you.
Mhm.
Also, I'd like to introduce Tony Puloka. It's also one of our co-hosts. That's the owner of Manamo'ui. We just did a successful health fair events, right, Brenda?
Yes.
On Tuesday, November 9, and we're having another one coming up on December 9. Okay, so the topic, Tony, that we're talking about right now, it's about the health insurance. Whenever you're ready, you can always ask a question, but before we continue on, I would like to ask the second question, because this is one of the very important one that our community always asks about. What resources are there to help the Pacific Islanders in King County to get health insurance? Like for example, I know that some people, are documented and they live here in King County. Also, I am asking two questions at the same time. What about the people that aren't documented? Could you please clarify that? And if you don't, you can also ask me and I'll repeat the question.
Okay. So for the first question, how to get enroll or get health insurance, the King County Public Health, they have navigators in their offices, so you can go into those clinics and you can enroll. We also have an office over here at Federal Way. The address is 1640 South 318 Place, Suite B, Federal Way, Washington 98003. You can also walk in and enroll. We also, for the Pacific Islander, there's Pacific Island Health Board, and Tiala can put the address on the chat because you can also enroll with them. Enroll also with Apple Health and Qualified Health Plan. We also have Pacific Islander Community Association in Federal Way. I'm sorry, I don't have that address right now, but Kate, I think I'll send it to you so you can send it out to the group. They have navigators, certified navigator at these two community-based place, and they can enroll any client that walks in. And what was the other question?
The question is, I have this couple people already text and ask, what about the folks that are undocumented in this country?
Well,
If they have lived here for a long time, for many years, but they wanted to get a health insurance, is there any program, that they can be able to get some health assistance when they go see the doctors or buy their prescription?
yeah, well, that's the new program that just came out for undocumented. So if you walk into any clinic and they can enroll you for that, for those, because that program just started right now at the beginning of this month. So it's really new program. But yes, now we have a program to help the undocumented. It also depends on like your status and your income also. There are some that they pay their premium. Mostly it's like qualified health plan. It's not the Apple Health. Apple Health or the Medicaid, so that's different. The undocumented one is going to be QHP.
Did you say QH?
Yeah, qualified health plan,
Oh,
which
QHP,
they
yeah.
pay. Yeah.
So
So-
thank you so much. That's we'll try to spread it. QHP is for qualified health plan. So
Yes.
it doesn't matter if they have any document, to live in the country, but they have to apply for it.
Yes. Yes.
Oh, thank you.
Excuse me, Brenda, can I ask you something about the program?
Yes.
Okay, now, you said that they depend on their status and income. Now, status, they're undocumented, or they overstayer. What do you mean when you say status?
So when there are some people that if they are eligible for the tax credit, they might pay nothing or less. It depends on that. But if they don't have that, then they might pay maybe 100, 300, 200, depend on all the information we have to put it in the system.
I see, okay.
It's
I
not a
see.
set number. It's not a set number to
Okay.
what they're gonna pay for.
Right. Now, with, is that, and then you said income. How do you verify that if they're undocumented?
We cannot. We will just take what they say.
What they tell you. Okay,
Yeah.
okay. All right,
Especially if
Because
they
it
don't
would-
have Social Security.
yeah. and some of them do, because when we disseminate this information to our community, I'm sure that they will ask
Mhm.
and they'll ask us questions. So we just need to give them just a basic, basic answer, and then
Yeah.
they'll come to the clinic and have them fill out the applications. And okay, wonderful. No, that's great. That is wonderful. Health is becoming a big issue in our community now, and I'm
Yes.
sure that you're aware of that. Yes.
And would it be
Okay.
all right if I chimed in a bit on this question as well?
Yes. Thank you.
Yeah. So, thank you, Brenda. I appreciate all the
Mhm.
expertise we get to learn from you. So in Washington State, they recently passed a bill, and in that bill, it was to allow for undocumented folks to get insurance coverage. What Brenda brought up of it won't be free. So the open enrollment period of November 1st to January 15th, that's the period that undocumented folks will be able to apply through. And then later in July of 2024, that's when the state is set to open up Apple Health for undocumented folks.
Oh.
I see, but now Apple Health is not available to the undocumented. Is what he's
No,
saying.
sir. No, sir.
Now
Yeah, they're still working on that.
okay, and the window is November. What? I'm sorry. Can you say that
July.
again? November.
July of next
November
year.
1st. For which one you're asking, Tony? Is
One
it
this year. Yeah,
for
the
now?
one that.
Yeah, you
Yeah.
have to enroll between November 1st to December 15 in order to have coverage start from January.
Starting
If
January.
you,
Okay.
yeah, if you enroll after December 15, which is the 16 to January 15, then the coverage will start on February.
Oh, I see. You can still enroll, but then your coverage will be
It's
delayed.
going to be, yeah, delayed.
Okay.
That's true.
No, that's wonderful.
Right.
Good information. And it's like what is that like Tessera? Sorry. What do you say?
Yeah,
It's not free. Okay. We need to let them know it's not free, but it's available. Yeah.
Yes.
Great.
Is there a premium involved? When you say it's not free, what?
Yeah,
sort of
that's going to
costs
be
are
premium.
involved? Is that the premium? So what is the cost of the premium cost?
It depends on the income, household
On income.
size, and all that. Yeah.
Okay. Thank you.
Mhm. You're welcome.
Oh, thank you. I just forgot, to see Dr. Sela Panapasa is joining with us. She's the one that running the federal research, like for the health for the Pacific, representing the Pacific Islanders, all the way from University of Michigan. Thank you, Dr. Sela Panapasa, for joining us. Yeah, she's the representative for us. And feel free, everyone. Thank you so much, for the two rep, from the PI Health Board. I have two families, that you guys were able to help them out get a health insurance, and they were very happy, very appreciative. One was a retired person, was able to get a health insurance coverage from you guys, and then also there was like a families of 5. They didn't even know what to do, and you guys were able to enroll them. Thank you again. So maybe if you have another question or any other service to ask Brenda at this time, you can go ahead. But I have a question that I can ask right now. What can health insurance help cover? Brenda?
What it can cover?
Yes.
Okay. Let's look at this way, because this is one of the reality. Let's say you go into hospital, you stay there 3 days, you will at least have a bill of $3,000. Or if you have a broken leg, that would cost you like maybe $35,000. Of course, we don't have that much money with us. So the reason you want to have insurance, because the insurance health coverage can help protect you from all these expenses and expensive charge that you cannot pay for it individually.
Brenda, can I chime in with a question? Do a lot of these healthcare plans, health insurance plans that are through the state, can they also help people pay for smaller healthcare services? Like maybe you have an infection and you need to go to the doctor, or you need just a regular checkup, like a pap smear or cancer, just a regular annual cancer test. Will these health insurance plans help pay for those sorts of things too?
Yes, usually they also have coverage on that, but I can confirm with my team, and then I'll be back with the post the correct detailed information on that. But usually with that plan, they always come with those.
That's great, because I think sometimes people can think, gosh, it's so expensive or it costs some money. I'm just going to risk it. I won't get in a car accident. I won't have a terrible accident, and maybe you get lucky and you don't. But I think insurance can do a whole lot more for people and can really help with those small costs so that you can stay safe and healthy day to day.
Yeah, good thing you brought up about the car, because that's the way you should look at it. Every time you pay your car insurance, even if you're not in accident right then, but you still pay your insurance every month. That way, if something happened, you got covered with that.
Okay.
And
Brenda, I just, as you talk, I think health insurance is very complicated. I just signed up for Medicare, a couple weeks ago, and I didn't realize how complicated it is,
Yes.
and fortunately I have someone that helped me kite through the, different kinds of options and what have you. But now, let me ask you this, because last week we had the health fair here, and there was about 22 vendors here. But I think
Approximately.
what in your program, it needs a more specific. So I think what I'm asking here, if we gather enough people, can we invite you to come and talk to them?
Yes.
Let's a group of folks that, especially in our community, invite them to come, and then you and your team will be here and talk to them and explain, because it's not that easy. It's it takes time to process this, and the different options. Different options.
That is so true. Yeah,
Yes.
that is so true.
And I also, just to follow up on Kate's remarks, and certainly tie in with Tony's request, Brenda is in, in the presentation on health insurance, is also emphasizing and perhaps clarifying coverage for prevention related attention, such as screenings, physical exams, so that basic blood work is conducted to determine people who are either diagnosed for certain diseases, etc., but also where insurance would cover treatment, the extent to which treatment is covered by the insurance. Because I think if we can promote prevention and coverage and support for prevention, whether it's cancer screenings or just treatment, getting blood work done for A1C and hypertension, etc., so that folks can at least have that information and at their disposal, and then also the additional support that insurance coverage would provide in the case of treatment for folks who are diagnosed with various chronic conditions or illnesses. That would help. I think would be extremely useful for the community.
That is true. I'm gonna send it to Kate, because not only it's complicated, but the words that is being used in insurance is like before I was a navigator, everything they talk about, it went over my head. I'm like, I have no idea what are you talking about. All I know is you're taking that much money and this much money and that much money, and I don't know what it's for. And those kind of when people see that they're gonna pay $50 for to see their doctor and all that. That's what they see, but they don't see what the whole bill is. Let's say the bill is like $600, but to see that doctor at that time and you only pay 10% of that, then they would know wow, with the insurance, I'm safe because I only pay 10% instead of paying that $600 or $700 bill.
Right. And that, I think, so the 10% you're referring to is the co-payment. Am I correct?
Yeah, sometimes it's 10%, or they might say
Right.
$30 for the co-payment.
And I think the co-payments would vary depending on
The clinic
of
charge,
the,
yeah.
right,
On the clinic,
care and
not the
treatment.
plan.
Mhm.
Okay, thank you. I have Pastor Araceli. I think he's asking. He wanted to ask a question. Go ahead, Pastor Araceli from the islands of Fiji. Before we continue on, I would like to ask everybody, please share this. These are all community leaders. Please share this. To your communities and leaders, and then also compile all the information, and then you can share it, in your native language. Thank you. Go ahead, Pastor Araceli.
Just a quick question. Regarding to the undocumented, application for health insurance. I think one of the important things that I'm thinking about and being concerned with, it's like the release of information, of the undocumented. It's something that they don't do much, and they'd rather stay back and keep the information with the sickness. The question is that comes to mind: is there a safe place where they can be given for the release of information so that they can take advantage of the opportunity that's you guys already have made available for us? From that standpoint, and they'd rather stay with it and with the sickness, because their releasing of their information, it's open up more doors, which is that they don't know what will be what will be the result of this. I would just think if there is a safe place, a safe environment in which they can be given the liberty to express themselves without and just get what they need to get a hold of.
Okay, that is really a good question, because there are so many undocumented that they would rather be sick than come and seek health coverage because of that fear that, they might be turned into custom and they might take them from their family, and those kind of thinking makes them afraid to come out. But like I said, the good thing about the new program that comes out for the undocumented, everything there's safe. We don't share anything with other entity other than get you to have that health coverage.
Thank you.
And I think, Pastor Araceli, you're absolutely correct, and that's why I brought up the first question. See, when you, Araceli, and me go talk to our friends and our people that we know, they already trust you.
Yeah.
But when Brenda, sorry Brenda, but Brenda shows up, they don't know, she works for the state or works for the government. They kind of go back. But if the community leaders already developed the relationships with our community, say, look, there's free, well, it's not free, but there's opportunities available here. Let's go. And I think that's why I ask if we have ask you, Brenda, to come, and then probably Brother Araceli and me can organize something where we can. Our community already trusts us, hopefully.
Yeah, Thank you, Tony, for bringing that up, because since I become a navigator, public health always make event, and then we'll make the event, some will come. But when we partner with BIB or Pacific, PICA, and then there's a difference. We will see a lot of more people coming in. It's just because that's their safe ground and they're more familiar with the other islanders.
Can I also chime in? I'm sorry, I know Viola Lelai has his hands up. So he has a question, Tima, but I just posted. The other thing I would like to emphasize that would, I think, provide further protection in your promotion of insurance in the within the community is recognizing the fact that patient practitioner physician relationship interaction, their interaction with the healthcare system is protected by law. It it would fall under the HIPAA regulations. So the concern that the pastor raised about that being undocumented, you're so vulnerable and susceptible to having your personal information and status disclosed or shared with immigration and other federal agencies. That is not going to happen because it is protected by HIPAA.
Exactly.
So your practitioner, the healthcare provider, is required to guard your personal health medical information from any other federal agency and without your consent. So I think that is important information. This one case where if you are undocumented and you need medical care and are receiving it with insurance coverage or without, your information is protected by law under the HIPAA patient right regulation. So I'm just going to end there and jump to Violelai Talofa to ask his question.
Let me.
Thank
Okay,
you.
before we continue on with Lai from the PI Health Board, thank you so much, Dr. Stella Panabasa, for the clarification. That's what it's all matters. This is a almost like a dialogue, and then we discussed, all the necessary thing that will benefit, accordingly, to, to our community abroad. It makes it safe, and also we have to comply with the regulation and the rules. Okay, continuing on, Lai will be next from the PI Health Board. Go ahead.
So my question to you, Brenda, would be a lot of our community members and all the PI community don't really know what kind of services are offered in the healthcare package, like Apple Health. What are some of the top 3 services that you think that a lot of the Pacific Islanders can benefit from taking the Apple Healthcare?
For the Apple Health, Apple Health Medicaid, it's for the children and for the 19 to 64 and also pregnant women. So for pregnancy, that would be good for them to go for their regular doctor. And being on Apple Health will give them access to all those. For the people that they have those chronic disease, being on the Apple Health is you also have that coverage for the preventive care and for the medicine. Of course, the dental for adult is limited, but still you can you can go for x-ray cleaning, the basic to prevent you from any damage to your mouth, right? And of course, for the children, if they're on Medicaid, they can update with their immunization and also for regular checkup. Also, the good thing about it is when you go for a checkup or physical checkup, you don't have to wait till you're really sick and go to the emergency room, because you always go to your doctor first, which is covered under your HAPL. Did I answer your question?
Yes, you did. Thank you.
Okay.
And also, correct me if I'm wrong, but to be able to apply, to be qualified for Apple Health, you also have to be planning to live in Washington State, correct? Or am I wrong?
Yes.
Yes, all the to be over here, for the Apple Health, yes, you have to be intend to be resident of Washington State.
So it doesn't matter if because I know some programs in Washington, you have to stay in Washington for a certain amount of time to be considered a resident. But for Apple Health, if you're intending to stay in Apple Health, I mean in Washington, then you are qualified for Apple Health. Is that correct?
Well, then I will get back with the correct answer, because there are some that they will not be eligible for, and I don't know about majority of the Pacific Islander. I know the COFA, which is like people from the Marshall Island to the Palau.
Yeah.
You just come in today, tomorrow you can get your insurance. But the other islanders, Pacific Islander, I don't know if they have to have that 5 years to be resident in order to be on Apple Health. That one I need to make confirm with the team to come back with the correct answer. I don't want to say that no, you will not be eligible. But I always told that it's better to put the information in the system, and the system will come up with which if they're eligible or not. That's what I was told. And so far, like all the Pacific Islander I've been putting, I haven't have any issue with them not getting Apple Health or the Medicaid. And that's here in Washington State.
Okay.
Thank you.
Thank you so
Sylvia, I
much,
just
Brenda.
want to
Yeah.
chime in just so you know that we've also got Deborah Berliner here to talk about COVID. And I'm so happy that there are so many questions about insurance. And even though I work at the health department, I also am learning things here, and I'm still kind of confused by it all. So don't want to cut off the conversation, and just want to make sure folks know we've got one other person to interview at some point in this hour.
Okay. Well, thank you, Deborah Belina, for being patient. In the meantime, we'll play just like maybe 10 seconds, a little melodious song, for the transition.
$1.5 while we're listening to music.
Thank you, because we're running out of time, and I'd like to get back to to our next topic discussion with Deborah Belina. Thank you so much, Deborah, for being patient and dealing with us, on our conversation. As we are going to continue on, I'd just like to maybe mention to Brenda Collect. There was a couple people. You can just also maybe put it on a text, or you can always get back to me. These couple people were asking. We have been retired for the past 10 years, and we were not qualified, for the Apple Health. Is there any way that you could be able to have any program or maybe the PI Health Board rep, because it is so much, so cost and very expensive to buy all our medication, and we cannot really afford. And is there any other program that you can suggest, to help and assist us? That's it, as we continue on with Deborah Belina. Welcome, Deborah Belina, to the Voice of South Pacific, a Pacific Islanders broadcast. Thank you so much for coming in. And so we're talking about the COVID. And I know I have Sina Aloita Funapeka that is with us. She's one of the leaders, for the elderly. And I know this time of the year it's called like flu season, or it's difficult. Thank you so much for all coming on November 9th, for our health fair. So I'd like to just lead us, with this question. Are we seeing an increase in the COVID cases right now? Thank you, Deborah.
Yeah, well, thank you for having me. It's a pleasure to be here with you all. And I will say, we don't have the data that we used to about COVID cases, because you'll all remember back at the start of the pandemic in the first year or two, when you didn't feel well, you'd go to a testing center, you'd get tested, that data would get reported to public health. So we had a very good read on the number of cases, the distribution in the community. And these days, most COVID tests are done at home. We're just doing them on our own time, and that doesn't get reported to us. And, to be frank, also a lot of people don't test when they have symptoms. They might mistake it for a cold or a flu, or be asymptomatic and just not have symptoms. So we don't know the data around cases, but we can look at hospitalizations. And if we go back just a little ways to September, there was a surge in cases. We're in a better place now. A surge in hospitalizations. And hospitalization rate is low, but we're entering respiratory virus season, the season where COVID, flu, RSV, it's their moment. And with all of us gathering for holidays, traveling, going to see family, it's the best time for these diseases because they can spread really easily, and COVID's no exception. So we expect in the coming months to see a surge of cases or a surge of hospitalizations. And that makes this a really, really good time to get vaccinated, to protect yourself as we go into this heightened season.
Thank you so much, Brenda, for clarifying that. And now we got it very clear. It's how important it is, to protect yourself, taking a vaccine and a flu shot, COVID-19. Okay, the next question I will give a chance, to Sina. Sina, can you go ahead and ask your question?
Oh, thank you, Fatima. My next question, I have a couple questions. If you just answer one or both if possible. First question, how often seniors, members or senior citizens get COVID vaccine? And my next question, I had a couple of seniors who are worried that they don't record down their vaccine for COVID. So they worried if it's not recorded because they get used to carry that little card with the record, or is it already recorded in their ID?
Yeah,
thank you.
Great questions. So the first one was, how often should seniors get vaccinated? Everybody ages 5 and older at this point should get one updated COVID vaccine. And that includes seniors. And that's regardless. It doesn't matter whether you've had COVID before or you haven't had it, if you've been vaccinated or you haven't, if you've had boosters or not. Everybody 5 and older, seniors included, are recommended to get it. We're not at the point where we've established a schedule where we can say confidently that you're gonna get vaccinated once a year, like we do with flu vaccine. But it's looking to be, we're moving in that direction. It's likely that will happen, that next year there will be an updated vaccine, but that's still to be determined. And your second question was around some folks not worrying that their vaccinations have not been recorded. We are lucky in Washington. We have what's called the Immunization Information System. It's a statewide database. It's a registry where your immunizations are recorded. So when you do get a COVID vaccine at a mobile clinic, at a pharmacy, at your doctor's office, they are recording it in the statewide system. It might not be something that you easily access, but it is on record. So next time you go to the doctor or seek out a vaccination, your provider will know that you were vaccinated. And there's a way, if you want, to look that up yourself. It's called MyIR. This is an app that allows you to view and print your own vaccination records. So you can do that for your children, you can do that for yourself, regardless of your age. Great question.
Thank you so much. Thank you.
I have a question for Deborah.
Yeah.
The data you were referring to that's captured by the state registry, does it collect detail? I'm assuming it collects data on race and ethnicity. So NHPI would be captured, but do you also disaggregate the NHPI?
This is a very good, very complex question. There are mechanisms on the immunization registry to capture race ethnicity data. It's not always recorded by providers. So it's a much longer discussion. I actually was just hearing a presentation about this the other day because it required quite a bit of, it's so complex, it required quite a bit of time. But essentially, the data is limited, but it is a recordable field in the state registry. And I'm happy to follow up with more information or to connect you, Dr. Stella, with contacts at the State Department of Health. They manage the immunization registry.
No, thank you. That would be helpful. Follow up on the on whether the identifier of detailed NHPI groups is captured and certainly made available in the actual processing and when patients come in to get care, because that certainly would help with managing and monitoring prevalence for immunization across.
Absolutely. Yeah, I couldn't agree with you more about that. I mean, that's the direction personally I would like to see a lot of attention be put into, having clearer, more comprehensive and accurate data around race ethnicity to inform the work that the health boards do, that providers do, that community health centers do. It's essential. So yes, I'll be sure to follow up with you on that in particular. But thank you for that great question.
Thank you, Deborah Belaina. It's also Dr. Stella Panabasa. She represents the Pacific Islanders in the health study and research from University of Michigan. Thank you so much. Yeah. Okay. Who will be the next person to ask a question? You just raise your hand, and you will be next. Tony Poloka. Oh, okay, Lai. Lai have a lot of questions today. Go ahead, Lai, from the PI Health Board.
This is the simple question, but I'm actually really curious on what the global status of COVID is at the moment.
I am so sorry that I am going to pass on this question for the moment because I don't want to give you wrong information. It's such a good question. My focus in working for Public Health Seattle King County is mostly King County, but absolutely we're not existing in a vacuum, and we're all traveling all the time. All it takes is a plane ride to spread any disease. So it's a great question, and I would like to get back to you on that.
No worries, no worries. Thank you.
Yeah.
And the next, who will be next? You can raise your hands, or Tony Poloka. Oh, Tony, are you listening? Okay, next is Pastor Arceli. Pastor Arceli, I know you have another question about the vaccines. Can you please unmute?
So, just simple. What I think, how can people get help in getting this vaccine or this vaccine, vaccination?
Yeah. The most important question, right? How can people get vaccinated? Thank you for asking. So there are lots of good resources. One option for people living in South King County is the Public Health Kent Vaccination Clinic. They have COVID vaccine for people of all ages. So vaccination is recommended for children as young as 6 months and everybody older. And they are taking people who are insured and uninsured. And that is a great resource for South King County residents. For other folks, I recommend starting, if you do have a healthcare provider, seeing if you can make an appointment with them. And I'll note, just a plug for Brenda's work, the Community Health Access Program at King County can link people to a healthcare provider if they don't have one, or to health insurance. That's a great tie-in in the work that we're doing. So going to your own healthcare provider, going to a pharmacy, and, I want to be completely upfront right now across the nation. There is still we're feeling a little bit of delay in COVID vaccine availability. So it might take, if you try to make an appointment, you might need to wait a week or 2 weeks. I recommend going and visiting the website vaccines.gov. That is a federal website. And you can enter your zip code and the vaccines that you're seeking. So you can look for COVID vaccine, and maybe you also want to get your flu shot or your RSV vaccine at the same time. You enter your zip code and it will give you a list of locations near you, generally pharmacies. And you can also text your zip code to GetVax, which is GETVAX, and they will send you a list of locations near you. And again, most places at the moment, I would try to make an appointment, but eventually over the next few weeks, we'll be seeing that walk-ins are more and more open. Does that answer your question?
Thank you, ma'am.
Okay, great.
Deborah, quick question. Is the state offering free COVID testing kits to every household?
Okay. This is another question where I'm sorry, I want to get the most up-to-date answer, and I'll put that in the chat before we end. Thank you.
Okay. Thank you. Yeah, Stella has a lot of challenging questions.
Yeah, I'm sorry. I'm.
But that's good, it's giving us more information. Thank you, Dr. Stella.
But it's also, it's just services that my understanding is that it's nationally available, it's nationwide, and it's enforced here in the state of Michigan. So I was just curious and assuming that that service is offered to households in Washington.
Yeah, so I can confirm that it is. And it will be available through the end of the year while supplies last. And I can put a link to the chat with more information. And I'll just note also that Washington residents can order up to 10 free at-home test kits per month. The program is called Say Yes COVID Test. And that is also the website that you'll visit, sayyescovidhometest.org.
Okay, thank you. I have a Vicky Navarro. It's the King County Healthcare Coordinator. Vicky Navarro was also help out, with our last event in Burien at Manamo'ui Center. There was a great turnout, and we vaccinated 30 folks, most of which were both COVID and flu. Invitation to all December 9. We'll have the same one on December 9. But before we continue on, I would like to ask a question from some folks here. They were saying, our family got vaccinated, but we have an elderly person, 76 years old, still got sick, with it. Why should, start getting the COVID vaccine if our elderly is still getting sick? It's not like an offensive question. It's just like the people need to maybe have a safer, more understanding answer.
It's an excellent question. It's the best question I can think of because a lot of us have been vaccinated and have gone on to get COVID. But the key is that we are so much less likely if we're vaccinated to be hospitalized, to be have severe consequences, to get long COVID, right? Long COVID is when you've had COVID, you have a negative test after 8-9 days, however long, but then you feel terrible for weeks, months, or longer afterwards. You might feel fatigue, you might feel muscle aches. These are all reasons to get vaccinated. Even if you do get COVID, you're much less likely to be severely ill. And I want to note, there are a few reasons that we recommend vaccination frequently. Why we don't just do it once. Certain vaccines, like say chickenpox vaccine, we get it, you get a few doses and then you are done, and you don't have to think about it again. But COVID, a couple things happen. One is that the protection that we get from vaccination or our immunity, it fades over time, kind of like with the flu vaccine. So if you get it, you got it a year ago, now you don't get vaccinated again, you're not going to have as much protection. So it's important to get another vaccination. Another reason that we get more vaccines on a regular basis with diseases like COVID are that the virus that causes COVID, it's constantly changing. So we need our vaccine to match the virus that's circulating in the community in order for us to have the best protection. If we only got a vaccine, when it first came out, it will provide some protection, but it won't be a good match. It won't be a good, it won't be able to fight hard against the virus that's out there now. I want to also just mention, if we look across, we all share the same experience of being in a really different place in, November 2023 than we were 3 years ago, November 2020, right? I know you can all remember when you'd find out that someone tested positive for COVID. It was terrifying, right? You didn't know if that person was going to end up in the hospital, if they would be put on a ventilator, if they would survive. And those were very legitimate questions to ask of anyone, regardless of their age. Even for a young person, you could ask, will they be okay? And now, to be honest, when a friend of mine tells me that they tested positive for COVID and I know that they're fully vaccinated, my response is usually, really sorry. And do you need some chicken soup? And, what are you planning on binge watching this week? Right? Not that COVID isn't serious. It can be very serious, even when you're vaccinated in rare cases. But vaccination is responsible for that massive change where we are able to go about our lives, go to parties, travel, celebrate. That's largely because of vaccination. And I think, yes, there are situations where a vaccine doesn't work for somebody to provide all the protection that we hope that it will and have confidence that it will. But for most of us, it's going to be the difference between a pesky, inconvenient week at home, feeling not so great, and being in the hospital, or potentially having more severe consequences or even dying. Long answer. I hope that was.
So I have a very general question for Kate, for everyone. That is with regards to the topics that are being covered around COVID or health prevention. If there's health promotion and health educational materials as part of your outreach educational efforts to the community, is the information tailored for each of the groups? Is it translated? Is some of the basic information that we've been discussing available in language? And if so, or if not, is there support by the King County Public Health Department in partnership with the Pacific Island Health Board and with Brenda's help and the help of the PI leaders such as Tony in providing in language information, whether it's some of the fact sheets or toolkits that could be disseminated in the community?
Yeah, and I will let Kate answer this as well, but we do have resources in several dozen languages on our website, kingcounty.gov/vaccine about COVID. You can find infographics, you can find various fact sheets. Kate, do you have any other recommendations?
Yeah. Thank you so much for asking this, Dr. Sella. And definitely both language access is so important, as is that kind of cultural competency piece. So like Deborah was saying, our web pages have content in many different languages. But in addition, we recognize this isn't just about going to a website and seeing something that's been translated. So we know that kind of community touch and community relationship to tailor the work can be so important. So, there's the team. Sorry, say that again?
No, the island. So do the languages you're referring to include these Pacific Island languages?
I would have to look through the list to be able to tell you. I don't know them all off the top of my head. But I want to talk through a few other resources that we have. We work with a group that we call community navigators. And so these are community leaders from different language groups and ethnic groups and cultural groups within King County who have those established relationships that often, me as a person working in the department as a white woman may not have. And so they both speak the language, but also have those relationships. And so that's how we've been doing a big piece of our kind of education outreach push is through them. And I know that we do have Pacific Islander members of that community navigator group, though I don't know names of everyone's. I work more on the media side than the navigator side. And then I see Brenda's hand is up, so I'll say one brief thing about the work that Brenda does, but then hand it over to her. I put it in the chat, but I want to make sure people know, Brenda talked through a lot of different resources about health insurance, and this information can be so confusing and so personal to your own individual situation and income and when you moved, et cetera. And so King County provides a free service in many different languages where people can call or email and get free help applying to any kind of health insurance, free help figuring out what they might be eligible for. And then in addition, just free help connecting with resources. So maybe it's you've got health insurance, but you're trying to figure out where can I get vaccinated and they'll accept this health insurance. And so I've put the phone number in the chat and the email, but I can say it aloud in a second once I look it up again. But folks can call that number or email and talk with a person who speaks their language and get that personalized assistance in figuring some of this out. And Brenda, with that, I'll hand it to you to go into that in more detail if you want.
Yeah, just want to also share that ACA also have, because ACA had the COFA healthcare before, so they have the languages in all 6 COFA nation.
Mhm.
So, yeah.
But that does not include, Samoan, Tongan, Fijian.
Yeah, I don't know if they have Samoan or Fijian, but I know about the COFA, so that one I'm sharing with you.
So, if I could just put in a plug-in for the inclusion of these other languages, given their relative size as a population and their representation, because the languages are very different
Yep.
and unique, yet these are some of the most hard to reach and vulnerable groups.
So I just would note that I put a link in the chat to COVID-19 information resources, and it is available. The resources are available in Fijian. You mentioned Samoan,
Tongan.
and Tongan. Also,
Okay.
Marshallese. Are there other languages you were curious about?
No, and those were the main languages, since we have representation here as part of the discussion, but I will defer to the community to help identify the languages or the communities that could benefit tremendously from the translation of materials. And I assume, Brenda, you're the only NHPI navigator that's part of the public health department?
We have a
Oh,
lot.
for the public health, yes, I am. But we have so many navigators now for the Micronesian so far. And I think we have 5 Samoan navigators. So after last year, it's been growing really fast, and I can see it going forward, and hope to get more.
That'll be great.
Yeah, just to add up to that, during the pandemic, I think me and Sina were also like representing, like our Tongan community and some other various, translator in all the documents, we've been here in King County. And then I saw like multiple languages, to cover all the Pacific Islanders were all covered by the King County. So we just like, thank you, King County Public Health, for covered that.
And thank you, Sylvia and Pacific Island Health Board, for all of the work that you all have done. You've been really amazing partners. I also just want to chime in to say we're past our time. So I think unless there's maybe like one other burning question for Deborah, I may have to wrap up our public health folks.
Yes. Anybody would like to have another last question? And please, yeah.
Deborah, sorry that I missed part of your presentation here, but now seems like that COVID immunizations will be just like the flu. We're going to have to deal with it for the rest of our life. Is it true?
I think you're right. I can't say that definitively. The jury is still out on exactly how often we'll need to get a COVID vaccine and whether it will be an annual shot like the flu shot. But yes, I'm completely of the opinion, and I think the data supports that COVID is with us, and just like the flu, it's it's just a part of our environment now. Good question.
Good.
Yeah. And I just want to mention, Dr. We were talking about representation among public health staff. We have an amazing advocate, Cioli Kalepo. I don't know, I'm sure many of you know him, but he actually oversees our community navigator program. And I just can't sing his praise enough. So I'm so glad to have him be leading the way around a lot of our COVID work and community engagement.
Thank you. I just want to add on to all you ladies and gentlemen, beautiful conversation tonight. I will share with my seniors program tomorrow. Dr. Sela, I learned a lot today and looking forward for future conversation with you all. Malo.
Thank you.
Yeah, thank you. And thank you so much, our special guest today, Deborah Belina, and also Brenda Collect. Thank you, Kate Cole. And you're also like free to go, but I would like all us, all our participants, representing, different communities to please stay. And if you have like at least like 5 minutes, just to share something in your native language, and then before we close up. But you're all good to go, like King County Public
Thank
Health.
you.
Thank you
Thank
so
you
much.
so much.
Thank you very
Have a
much.
wonderful day.
So I would like to maybe ask the those two, like from the PI Health Board, also Pastor Aseli, Sina, just to have a little thing, Tony Puloka, and also we're so glad to know that Dr. Sela Panapasa is right here. She's the one that let our voice be heard, that she's bringing up a lot of great things, to make them recognize, who we are as Pacific Islander. But I'd like to give this opportunity, whoever just raise their hand first, just a little 5 minutes in your native language, like just about the information that we talk about, because that's how the people can comprehend all the detailed information. Okay, I have Lai. Okay, go ahead, Lai, from the PI Health Board. PI is the Pacific Islanders Health Board.
Talo falava lo ingo vai o le lai whakawasa Vilio Xavier King. O au o se tasi o le au whaingaluanga a le Pacific Islander Health Board of Washington. O la o matawhai oi o le lolongo atu lea i le mamalu o le atu nuu. Mata upu ese e te mawhai ai ona maua le fisoswani i le polokalama tau le soifua maloloinga. E ala lea i le matou ofisa o le Pacific Islander Health Board of Washington. E whamanatu atu o le aso November mua 2023 e o atu i le January 15, 2024 ua taua le open enrollment period. O le open enrollment period o vai kaimi rea o le tausanga ua tatala ilo le skala i le Washington Apple Health. O le Washington Apple Health o le ngolea o le insure o le skeke Washington. E ka vailo asiasi i atu i le whalemai te le po o se whalemai whaitu malo. Mai si polo ka lama tau le soifua malolo inga. A whaisai le sikala i se taimi ua mawai ai sa te ena pe whaaloa ina lau le sikala ma ua ae manatu e toa whaaulu se isi le sikala pe e te fia mana amia ona sue le tūlanga iai sau le sikala i se taimi ua whaano whaafeso o tai mai i le Pacific Islander Health Board of Washington i le numera telefoni tasi valu o tolu o valu fitu tasi tolu. Whaafetai. Thank you.
Malo lava. Now we miss Pastor Aseli. Okay, Gabby from Palau Islands, do you have anything to share in your native language?
Actually, I'm Diela from the Palau. Ano ako yung Diela uwegi, yung manager of Pacific Islander Health Board, at yung health navigator lam tera other Belau. Open enrollment period ra Washington State tawal mo ra November 1st, ang ringin mo January 15. As kung mga nga kari malgira la insurance, malubang so mal apply, mem caller ka ma'am ra 1888-308-7113. Officer ka ma'am mga ra 5 Washington, ra 521 12th Street East, Suite B. Sulang. Thank you.
Malo. Yeah, next is Sina from the First Tongan Senior Community.
Yeah, malo ma penga mari ko ni ko e whakahoka tupe uia ko e whakataha whaakofa ko ni ahoni ko loto ke se ata pongpong ki e polo kalame tau sinia whika aki ki he lea mahawinga na whaimia he toke tā sela pehe ki he kaunesi na nau sea ai me ai ngai nisi mahawinga ke tau sea ki a pongpong whika aki mo ilele pe whaipia me tau ki tā noa ki ke Christmas i party Christmas e kausinia e paho katoa pungpong ko ia o tate o palake te moto malo.
Malo Sina iyo Tony Puloka o kia me a ke ki fe loto ke whakaongo atu ki ho tau kāinga tonga community tonga ke nau mahino iang e ki hape ki minitsi ke tukat maa.
And I think it's what I'd like to see is because last week we had the fair, the health fair, and there was like 22 vendors here, and it was just so crowded. And I think what I was hoping to see is like we invite, let's say, Brenda and a couple of navigators or nurses from King County to come specifically for us, the Tongans. And so we can just, invite our community and then, come to the Samoans. And so, because when it's too crowded, it's, especially health insurance is very complicated. It's not an easy subject, and that's what I'm hoping to see if we can set a time, a date, and invite them to come and share these, especially with the new health insurance for the undocumented folks. I think it's really important for our community, especially us. The Samoans. American Samoans. A lot of them are U.S. citizens, but us and other folks from Western Samoa and other Pacific Islanders, I think they really need this health insurance. But that's just what I was hoping to see if we can get a date. So I know that on the 9th of December, that's when we're gonna have, and it's gonna be, it's gonna be crowded, and there were like many different vendors will be here. But I don't know. It's just a thought that I was hoping to see.
Malapita Tony, yeah, I can work on it, to have someone to come over and to do enrollment, like for our Tongan people, and then also have someone, they can go around. But I think they already work with the Samoan community. It's just that this is the first time ever to have a health fair, with our community, including Tongan. But we'll have like something that, go directly for our community so that our Tongan people get get more access to the information that is available, especially with the health insurance. Thank you so much. Yeah.
Yes, like the language. We talk about the language because if they show up here and we have different, ethnicity here, different, it has to be in English.
Yeah, I thought you were talking about like to have something just for the Tongan.
If we have specifically for the Samoans, the Tongans, so that you can explain it to them in their language, is what I'm saying.
Yeah, we got it. Okay, thank you. Yeah, koe mea mau inga pe ka pau kai ngā tonga ka pau mo mea mai I he au pe o lava ke mo access ke information kon I whai kai pōtala noa. The thing that we will talk about, like the health insurance and also about the COVID-19 vaccine. Ai koe mea mau inga na asi mai o kui ai rewa whainga maali ka ki tau te whito kia ki nau tolu ko ia o kui kai ke iaha nau pepa no whonua e whonuani. O ko ke iai pe mo ngai polo kalama ke lava tō ni ai ki motol. Ka te mau whenga lewa I he wawe taha ke iaha ki taim ke nau hangaton mai pe ko e whaata atuen ke kakaitonga ko nau whe mau ke nau mai o enroll ki he hange ko health insurance ko mea ko ia. Pea toki lere pe mo health fair ia ko ne o ko ma set up ko ia mo Vicky Navarro hoste he Tongan TCRC Tongan Community Resource ke au hiva ko ia o December. This is one of the great things, to share that, like they come over and just do the health enrollment for our people that need that, directly for the Tongan, and then other than the health fair, including all Pacific Islanders, or anybody that needs it. Okay, I think we're coming to an end. Dr. Sella, do you have anything else to share before we close up for the day? But we do appreciate your time.
Well, thank you, Sylvia. I just want to follow up on Tony's point and emphasize, because the concern was raised earlier about concerns on the part of the undocumented with having their information, personal information released as part of their enrollment in health insurance. While on one hand, it is important that they receive access to health insurance for their own health care in general. I think that concern could be tempered. Perhaps if we also emphasize as part of the educational information in reminding them and emphasizing the fact that any interaction with healthcare is protected by HIPAA.
Right.
So the concern that their information, personal information, will be shared with other federal agencies such as immigration, Homeland Security, etc., is not going to happen. But I do have a question, and that is currently for the undocumented. If they do need health care, they're probably waiting till the pain is unbearable and they end up in the emergency room. Is that the common sort of pattern among our undocumented PIs? Is that if they're not receiving regular checkups or going to get regular attention for health, access to health care, they're probably waiting till it's by the time they get, seeking help from an emergency room. And if so, by then, whatever the problem is could be very far along or worse.
Correct. And I think that's, I think that's a correct statement, Sarah.
Okay. It's just an observation from other anecdotal evidence with other PIs in other states, where particularly in the case of cancer, that where they find themselves going in because the pain is unbearable, only to be told and diagnosed that you have stage 4 cancer of some sorts. And by then it's, of course, the cost of treatment may not be an option because they're so far along, or the cost for treatment in the absence of health insurance is just unbearable. So they end up dying. I mean, mortality risk is very high.
Yeah, and I think it's also go hand in hand with your advocating doing preventative testing.
Right. And the prevention will be well supported if you have health insurance.
Correct.
It will give you access to screening, regular physical checkups, monitoring, the health status, etc. And that's one more reason why having insurance would be most beneficial.
And I think it'll come with more education and more discussion. Talk when you talk, because a lot of us, you don't want to spend your time in talking about something that you're not sick. You only pay attention when you get sick. So,
Right.
anyway, yeah.
Thank you.
Yeah. Thank you so much. Yeah, those are all great topic discussion, that is very relevant to our community abroad. But as far as I know that from more than 20 years ago, I know that some of the people when they were here, like including I've seen a lot of the people come from the islands and they gave birth, to their kids over here, but they don't even have any insurance. They were just coming over here and they gave birth, and then after that they went back, to their home country. But they didn't pay anything because at all those, there was some program, with the government, that covered those people, just like almost like a same type of health program that goes to the refugee. And then also like when people are in critical condition and they go into the ER, they're not denied, because they don't have any health insurance. The state will treat them, and also there is some coverage, but they still bill them. But at coming to a point, they cannot pay. There's always some other option, like to apply for, but they are not, neglected, by the hospital or the health facility because they didn't have any health insurance. They just getting their detailed information and they bill them out after that, but I think it was maybe a Keynes with the other government requirement, to deny anybody, especially when they're in the status of critical condition. But otherwise, that's as far as my experience of knowing those things. Because about like 13 years ago, I was doing ambassador, like for, reaching out for a new healthcare. It's called Fidelis, and now it's Concedo. And so that's how I learned about the Apple Health, the Medicaid and the Medicare. What's the difference, and how the people can qualify for this. And then some people end up, like having both, dual health plan. But the only thing that, maybe I should just ask,
Fatima, I gotta go, but hey, thank you very much.
Yeah.
Sarah, good to see you again. All right,
Yeah.
gotta go. Thank you.
Thanks, Tony. Yeah.
Thank you.
Yeah, Stella, I'd just like to ask that question. Do you have any suggestions? I will bring it up, to those, the PI Health Board, because they were helping out some people. They were retired, like 10 years ago. Do you know if people, they complain because they were hardworking and they end up, retiring, and they paying, a lot of money out of their own pocket to pay for the medical bills. And here are the people that don't work at all, and they just, getting the Apple Health, and they get Medicare based on their age level, and they don't pay nothing. So do you have any other, as far as your research study experience, but maybe Lai will know about it too, eh?
I would check with local first because it's local.
It's local, yeah.
I mean, I'm not familiar with the local insurance plans like the Apple plan.
So unfortunately, I do need to leave because I have a policy meeting in like at 3:30.
Okay.
But Diella was actually the one that taught me everything that I know. So I would actually ask her, and she left her email, or I can leave her email for you guys as well. But here, I'll leave that right now.
Okay. Thank you, La'a. Thank you so much for joining with us with our Pacific Islanders population communication on health with our PI population in the community in Washington State.
No worries.
Thank you.
Thank you, Etty. Thank you, everyone.
Thank you. And also, thank you, Dr. Stella. And I only have the two of you. Those are my two angels. Yes. Thank you so much, Dr. Stella, for taking the time.
No,
do you have any suggested topic? That maybe you think it's very relevant out of your experience for many years doing the research study? Because I know I learned that from you. When I saw the health data of the highest obese in the world, it was end up, about 3 or 4 years ago, it was showing that Tongan and Samoan, but it's not like that we curse them or anything. No, it's nice to be aware, and it's nice to give them information, so that we could try to not consume a lot of lavishly food and insecurity food.
Right. Well, the other thing is that, these chronic diseases that our community and families,
Dialysis, cancer,
loved ones are affected by is all preventable, is actually
Yes.
preventable.
Yes.
And so we have a choice, but that choice would come with having accurate information and having the tools and being empowered to be able to make those healthy choices and maintain it. So and the program doesn't have to be, it's not being judgmental. And,
Right.
Our people are welcome to eat their foods, but perhaps eat it in moderation, if they understood. Because the body can only consume and process so much, right?
Right.
And as we get older, you find yourself consuming less, or your body needs less. because our metabolism isn't as active as a 18-year-old, 20, 30-year-old. But that's also the age in the 50s where you're at very high risk of prediabetes and diabetes and other chronic diseases. So so the point I would like to make is that, all this attention to prevention is critical.
Yes.
And you can save yourself a lot of money, a lot of pain and discomfort from all this prevention. And if there's a way, since we cannot directly impact and affect change at the corporate level that is supplying the food chain with all this unhealthy foods, etc., we perhaps could, from the grassroots up, we just reject the foods and save money on eating healthy and eating, normal sized portions than having to feed into the profits of these corporations that are producing cheap, unhealthy, poor nutritious foods. So, it's something I'm working on, and but I'm a firm believer, having participated in some of the programs where this is the answer. And since we're blessed with a brain that puts us at a much higher power level of all the animal species, if I may, that we could make these choices and making healthy choices. I love our island foods, but eating it in moderation and is perhaps is going to be helpful. But Sina, I think, would chime in, and since Sina works with the elder members of the community,
Yes.
I think there's a lot of truth in
Yes.
terms of their dietary
Yeah.
needs and how much the body can consume, and they're probably healthier than our younger generation or this young future generation that's coming up.
Absolutely right.
Thank you.
That Sina got like one of the best top chef, and she's very healthy as far as preparing the meal, accordingly, do the have a little vegetables or always something, to add on a meal every Wednesday. And I saw that, and it's just like the volume, that's just enough. But I'm so glad that she got into that, and and having like almost like a healthy, diet. It's a cooked food, but it's for them to enjoy, and they having like a little exercise program too, right, Sina?
Right.
Yeah.
And
Malosela, quick note to add on. There's two things I learned, from being a volunteer at running the senior program is access. You have to have access to language, access to food, access to other organizations. If you do not have access, then you find yourself floating. And that's the number one thing that I learned, is to make sure that I had the access. If you had access to the right people, they will help with you. And that's number one thing is nutrition. Because our seniors love Tongan island food. If you want to ask them to eat vegetable, they will not eat until there's a ufi or taro or sipi or lu add on to their nutrition. So what we do, I learned, is to get some nutrition individual come in. So we have a team who come in every other month and do a little class to our seniors. And
very
I want
nice.
to make sure that they know that do not take the island food from our seniors, but maybe educate them into add on something to eat along with island foods like vegetables. Some of the vegetables that our islanders or my sweet seniors do not want to eat.
Right.
So those, that those are most important things for them to eat is vegetable fibers, vitamins here and there. Is having nutrition come in and into class. To me, we have to make sure our volunteers need to make sure that we understand first,
Right.
before we educate our seniors.
So do you have documentation?
But I'm very thankful. I'm very proud of you to when you bring out language. Language is very important. Some of the very important resource for our islanders, but they don't have the language. The translation is not there in the book, in the hardcover book. Right. So I think that that's very important for them to realize, so they can start work on it now. So that next generation, there's Tongan or Samoan language in every information out there.
Right. So Sina, if I may, all that work with the nutritionists in helping you tailor and adapt the island food and make it healthier, etc., and the information. Do you have documentation? Is that documented?
Yes, we have a menu list that everything had to be paperwork. We document and we date it, and what works, what did not work, what need to be more educated for our program. Those are very important. Paperwork documents very important in our program,
right?
Especially when it comes to
and is that information summarized, or is there a report on all that information that you're documenting?
We have it within our program. We have it within our program where we file and report to the right organization when asked. Okay. Because we are partnering with the City of Seattle, King County, organization called Sound Generations. Mm-hmm. So they are the nonprofit organization that we are under.
Right. So is that information you can share with me? Whether it's the
if it's have to do with but it's all about access. Right. If it's accessible and something that will help our community.
Right.
And it's for all.
Right.
Yes.
No, I would, and well, I can follow up with you. You and I can have a separate conversation, because I would like to learn more about your program and the type of information that you've been able to adapt.
Yes.
That was useful. Because I would be interested in seeing how that adaptation can be applied for diabetes prevention and diabetes self-management in our PI community, the Tongan Samoans, etc. And that would be very, very useful. I mean, I have access to information working with that was implemented in the Micronesian community. But knowing, the work with the PIs, one size does not fit all, even though there may be some commonalities because of the culture, the Pacific, coming from the Pacific, but really getting down to implementing and tailoring the work for each group is where we would see some variation.
Great. Great.
Yeah.
But
thank you, Dr. Sela, and also Sina, because our time of our radio engineer, is lining up, yeah. It's about like 3:41, we were supposed to end at 3 o'clock. Yeah.
So Sina, how can I get your information?
I'll forward her information to you.
Tima will connect us.
Very good.
Yes. Thank you, Sister Dr. Sela. Yeah. And if you have any other more, like for other than Micronesia, like Samoan, Tongan, and Fijian, and the South Pacific, that's what the name after our program is. We can share it, so that we be like sharing, not just the Tongan, but for other, islanders communities, so we can try to all comprehend, like a healthy advice.
Well, Tima, how come you do not have a Tongan patient navigator with the King County Public Health
I
Department?
keep telling them like many times they want me to go into the Fijian
And get a
navigator,
Fijian
and then also
navigator.
I've been bringing it up. They have another person, but I'll talk to you on the side about it. It's not because this is not like directly from the county. The program today is directly from the Seattle King County Public Health. The navigator that assigned, that thing is, it's a different person, but I have to, because I keep bringing it up, like on that one. But
Let's push
otherwise,
on it,
because I don't
Stella.
want to kind of bypass and go directly to the Seattle King County because they really recognize our program very
Well,
much so.
but I
Yeah.
think this is where your advocacy, we need Tongan and a
Yes,
Fijian health
absolutely.
navigator recognized and
Yes,
supported by the health department.
yes,
Because
absolutely.
with all due respect, I don't think Brenda can do justice to the Tongan and Fijian
No,
communities.
Brenda is Methodist.
Right, she's Micronesian and she's going to be there for the COFA
Mm-hmm.
residents, and they've got a unique status that doesn't apply to the immigrants from the PI from the Pacific.
Especially, you're
But
right.
malo Alpito,
Malo
keep up
apito
good
to
work.
fasoi fua o falayat sela Dr.
Okay,
Sela.
Papadu.
Yeah,
okay,
next time you're gonna
bye.
come back again then. Yeah.
Let me know. Thank
Okay.
you.
Text
Bye-bye.
me
Bye.
text me Sela CE's
Stella
phone number.
CE's
Yeah.
contact. Yes, will
Okay,
do.
yeah. Thank you.
Tina, Opatu.
O
Bye-bye.
falayat. Yeah.
Bye-bye.
Yeah.
Bye-bye.
Thank you, Sina.
Okay.
Now we're coming to the conclusion of our program today. Thank you very much. This is the ending of our Seattle King County Public Health with everyone. You can tune in and find out more information about how to get health enrollment, health insurance open enrollment, and then also health insurance to cover those that does not even have any documented, or you qualified to receive any help, any assistance in the country. But otherwise, there's a lot of great information that can help everyone. Everyone, especially this is program here to serve our Pacific Islanders. Thank you, Seattle and King County Public Health. Thank you, Communication Officer Specialist Kate Cole, Brenda Kellett from the King County Public Health too, and then also Deborah Beliner from the vaccines site of the COVID-19. Thank you all for all our special guests from the islands of Fiji, Pastor Aseli, also the two from the PI Health Board, Lai and his co-host, the manager, and also Sina Loita Funapeka from the First Tongan Senior Community. And I hope I didn't leave anybody out. Oh, and also Tony Puloka from the Manamoi Center, and he's the owner. Thank you again. This is Sylvia Fatima Aho, and also David Unahefa. Thank you very much.